Is it September already? Hey! Today we're going to talk about a few things related to the portal for our safety meeting. And we're going to do a medical emergency. So the first thing I want to talk about is our new employee, Janet. We're very excited to have her on our team. So if you get an email or a call from her, answer it. It's her. She's been helping us. She's basically our office manager. So she's doing a lot of the reaching out. So yay, thank you for Janet. Then we're going to talk about seizures today, and then we're going to talk about a couple things that, kind of to-dos and some changes on the portal. So, first thing, as with any medical emergency, you want to know your patient. So, if your patient has a seizure disorder, if they have epilepsy, you want to know in advance when it happens, how long it lasts, what their aura is, right? Like, is there some kind of a sensation that they get before the seizure starts so that you can plan. So you would know that in advance. So if somebody has a seizure in your chair, you basically want to keep them safe. So a seizure, there's a couple different kinds of seizures. A seizure is basically a disturbance in the brain where the brain kind of does some funky wiring. So you either can have, the sort of classic, what they used to call a grand mal seizure, where there's a lot of jerky movements. Seizure can also be just staring off into space. So there's a couple different kinds. Know your patient, know what theirs is, right? If they have an aura and you know in advance, you can get them on the floor, you can put them in a safe position, but probably it's going to happen, maybe and you don't know. So in the patient chair, you want to take everything out of their mouth, move all the instruments out of the way. You want to keep them safe. That's your big goal, to keep them safe. So you want to be close enough to them so that they're not going to fall off the chair, but you want to be far enough away from them that you're not going to get hurt. So you time the seizure from the start, right? Because they're going to want to know afterwards how long it lasts. And you kind of keep them safe. You don't put anything in their mouth. You're not worried about them biting their tongue, nothing like that. Then, after that, when the seizure's over, if the patient has in advance told you that, listen, my seizures last this amount of time, this is how it goes, I don't want you to call 911, you don't, right? If everything's normal, but you do make sure that they have a ride home. That's really important. If it's anything different, a lot of people that have seizure disorders do want you to call 911 no matter what. So if the time is different, if they want you to call 911, if they hurt themselves, if they're pregnant, if they come out of it and they're just not the same, if they're having trouble breathing, if they've never had a seizure before, if they have a seizure and then it stops and then instantly they have another seizure, all those things are calling 911. And as always, it's always okay to call 911 just in case, right? We'd much rather have you guys call 911 than not. So that's what you do with a seizure. If you can get the person, as I said, on the floor and you can put them on their left side, great, in a recovery position, but it might be really hard in the chair. Your goal is to keep them safe, not putting anything in their mouth. All right? So that's the seizure thing. The other things I wanted to go over are, we've redone a couple things because we love it. If people have concerns or confusion, we love to kind of revamp things and make that better. So we've made a new flowchart for water testing and water failures. It shows sort of a little bit, I think, spaced out how you're supposed to test, or how often, and what happens if you fail a test. So that's in the portal now. We also put in some questions to ask your patients about sleep apnea. Since the ADA wants you to screen for sleep apnea, there are some screening questions in there. And then this sort of task for the month, if you guys could fill out the yearly PPE hazard assessment. It says clinical and non-clinical. You want to fill it out for both. The non-clinical right now, it just says, yep, I know I'm not wearing any PPE. Which actually is kind of important because sometimes we do see people in the front wearing gloves or doing things, so just kind of letting them know that the front doesn't have any PPE. And then I wanted to kind of reiterate when you can call us. We love it when you guys call us. There's a bunch of different things that you can call us for. If you have a charting question, if you have a patient dismissal question, if you're concerned about how to, the maintenance of equipment, if you have water testing, shocking questions, if there's a Sharps injury, if there's a patient dismissal, anything like that, always call us. We'd love to try to help and steer you in the right direction. And the big encompassing thing is I'm using an old-fashioned phone, but phone a friend. That's what we're here for, right? If you have any questions, just sometimes people just call and just kind of talk it out with us, and when we kind of figure out what the best plan of action is. So don't hesitate to call us. You have all our contact info. And that is it. So enjoy your September. I'm gonna try to, lay down and relax again, even though my dogs left me. Thanks.